Hi everyone, welcome to another episode on the oDoc webinar series. I'm Shabangi from the oDoc team, and I really hope everyone is safe and healthy and is staying indoors unless extremely necessary. So this week's topic is on dengue. Dengue seemed to have taken a backseat in the news over the last couple of months, actually for the past year and a half, I would say, but it's soon becoming a household concern yet again. There was a total of 31,162 suspected dengue cases for the year 2020, and we are at 12,098 suspected dengue cases till now from Jan 2021. So this is according to the epidemiology unit. So it's clear that there is an uprise in the dengue cases in Sri Lanka. To discuss everything related to dengue and how to protect yourself and your loved ones, we have Dr. Dulani Amarasena with us today. Dr. Dulani obtained an MBBS from the University of Ruhuna. She also holds 2 postgraduate diplomas in child health and family medicine from the Institute of Medicine at the University of Colombo. She also has over 35 years of experience in the field of medicine. Doctor, thank you so much for taking the time to be with us today and to educate us and our viewers on a really important topic, which, like I said earlier, has taken the backseat and not many people have been speaking about it. But clearly there's an increase in the numbers, and it is something we really need to be speaking about today. So thank you, Doctor, for being with us. It's a great honor to have you with us today.
Good evening. Thank you very much for kind introduction.
Thank you, Doctor. So if you don't mind, Doctor, I would love to jump straight into the questions. I have quite a lot prepared to ask.
Yes.
So before that, to all the viewers who are watching, if you have any questions that you would like to ask Dr. Dulani, please feel free to DM us, or you can post it in the comments section below, and I will ask them if time permits towards the end of this webinar. So the first question is, Doctor, as you know, everyone is talking about COVID and the symptoms around COVID and everything. And COVID is still at its peak, clearly. So people often assume that whenever they fall ill, that the first thing they think is, oh, it could be COVID. Are there any early signs that can help distinguish between COVID and dengue fever?
Yes. I think it is very natural for anybody to think whether they are having COVID or not nowadays if they get some illness. So being a viral disease, COVID is also a viral disease and dengue is also a viral disease. So it is very difficult to distinguish any viral disease from dengue at the beginning of the illnesses. Both of these conditions usually starts with fever. And the most important thing is because the...
Sorry, Doctor, that was the recording thing. You can go ahead.
That okay. Most important thing is the COVID-19 is so prevalent, so common in the country. You can have both these diseases at the same time in one patient. So I would say it's very difficult to diagnose at the beginning, but there are some signs where we should suspect whether this could be dengue. So those are especially headache. These dengue people used to get with the fever. All those things are fevers. So COVID also you get fever, dengue also you get fever. Illness start with the fever. So with the fever, they get severe headache, mostly behind the eyes. So that sign is towards whether you are having dengue or not. And vomitish feeling or vomiting. Even in the COVID, you can get it, but you have vomiting. You should think whether I am having dengue. And flushing. This is somewhat specific for the dengue fever. That is the erythema. That is some redness in the skin, especially over the face. You can see that redness. If you are a fair skin person, this is more obvious. Not only over the face, over the limbs, trunk, it's a reddish appearance of the skin. And since skin rashes also, you can get it in dengue fever. And joint pain and myalgia, especially back pain. these things are, you can get these things in both dengue and COVID, but if you get this severe pain, you should think whether I have got dengue. This dengue fever was originally in the ancient time, it was called breakbone fever. They called it like that because it is so painful, so myalgic. They think like whether my bones are breaking like. You can imagine how much pain you have when your bones are breaking. So that type of fever, pain they have. And other thing is, these are the clinical signs, and plus there's a very important investigation in both all of these viral fevers is the full blood count. In dengue fever, you get uh, reduction in your total white cell count and the platelet count. At the same time, your hematocrit or packed cell volume will go up. But the single WBC test, single full blood count is may not be giving your things at the first occasion. So you sometimes you may have to repeat these things. Even if it is normal, you have to repeat it. Especially before the third day of the illness, you have to fever. Any fever, if it's going beyond 3 days, during earliest on the third day, we have to get the full blood count done. And if you have these signs, the best thing is to consult your primary care doctor.
Great, doctor. Thank you for giving us those signs, warning signs that we can all look out for and help differentiate between COVID fever and dengue. Thank you for that, doctor. This actually leads me on to the second question. So with COVID, we know there's like multiple variants there, like the Delta variant, Alpha, and everything. But how many strains of dengue is it there? Like how many strains of dengue exist? Does a person develop immunity to all the strains if he or she has caught one strain of the fever before? Or is it worse for anyone who catches another strain as a reinfection? And if that is the case, what precautions must they take?
Yes, there are 4 strains. 1, 2, 3, 4. We have 4 strains of dengue virus. The immunity develops for the one strain. Sometimes it can cross react with the other strain's immunity. That means you might get antibodies after, say that after infection from type 2, you might get antibody to type 3 even. But it is very short lasting. It doesn't last too much. It's only few months like. So but if the immunity that you get for the present strain, that means if you infected by type 1, and the immunity for the type 1 will be long lasting, right? And reinfection, regarding reinfection, so usually what happens is if the first infection is from the type 1, second infection is from some other type. But if you get a second infection of any other type of dengue, you tend to get more severe disease. You have to be very careful about the second infection. But sometimes you may think that this time you are getting infected for the first time. But sometimes you may have been infected before with the asymptomatic illness, because 90% of you may not get the symptoms during the infection. So for the first time you are thinking this is the first infection, but it may be your secondary infection. So anyway, this immunity is not protective at all. That means if you might get for the second time, and the second infection will be more severe than the first one. Regarding the precautions, you asked for the precautions. So it is similar for the primary precautions. There's no specific things to do to avoid second infection. It is same as how to avoid first infection, which we will be talking later.
Right, got it, doctor. Thank you for that. like in today's, like if you take today's environment where it's very, very risky to even step into a hospital, you don't know what you're going to be exposed to. And in this condition and climate, is it mandatory to admit a patient who has been infected with the dengue virus to the nearest hospital? And given all the conditions and the climate that's going on, is it actually necessary, or can they actually be treated from home? And if so, what are the signs to look out for that show that the patient requires hospitalization?
No, it is not mandatory to admit all the patients, but it is mandatory to admit pregnant mothers, elderly patients, and very young patients, obese patients, and patients with some other illnesses, diabetes, heart disease, renal disease, that is kidney disease, and diseases with blood, those thalassemias, leukemias, and cancers. Those patients has to admit. You can't manage those patients at home. And some other people, they do not have better social circumstances. That means sometimes some people are living alone. Some people are living with the person who is not capable of taking care of. And some people are far away from the medical facilities and do not have reliable transport method. In that case, even without the warning signs, we have to admit those patients. And after that, other ones, except those people whose admission is mandatory, for other people, we have some warning signs. So if these people are having, if a dengue patient is having abdominal pain, that is your tummy pain, and pain while touching your tummy. And if you're having persistent vomiting, that means you can't control it. If it is once or twice, you may be able to feed the child or the adult once the vomiting is settled. But if you're having persistent vomiting, then you have to admit. And any bleeding, maybe from the nose, ear, or maybe from your inside, from your intestinal tract, that you can see if your vomiting has blood, or if you're passing blood from your downstairs, from your stools, then you have to admit. And if a patient is too lethargic, it's not active, and restless and irritable, those signs you have to admit. You can't look after them at home. If somebody is having their liver is enlarged, and if someone's full blood counts deteriorates, that means in the full blood count, your platelet count is going down and your hematocrit is going up, then you have to admit those patients. And you ask about the management at home. So if these, I'm sorry.
No
So
problem.
if these patients, your patients does not have any of the above signs, and when there's somebody to look after, and if you can rely on those people, you can ask them to keep the patient at home. Anyway, the primary care doctor has to see the patient before deciding whether to admit or to manage at home. So what you have to do at home, you have to give adequate fluid by mouth, right? Usually for an adult person, around 2,500 milliliters, that is 2.5 liters per 24 hours. If the patient is less than 50 kilograms in weight, you have to give 50 ml per kg for 24 hours. That is the amount that you have to give fluid. So that fluid should not only be water. You have to give king coconut water, other fruit juices, kanji, soup, and things like that in that 2,500 ml. And the next thing is rest. Patient should have the physical rest. And management of fever. So how do you manage the fever? For fever, we give paracetamol. paracetamol, how do you give the paracetamol? That is also important. For adult person, we give 2 tablets of paracetamol, that is 1 gram of paracetamol, 2 tablets of paracetamol per every 6 hourly. Every 6 hourly, and you should not give more than 4 times per day. You should not give less than 6 hours interval also. And this is very important. Sometimes your fever may not disappear with paracetamol, saying that you can't repeat the dose of paracetamol before 6 hours. And you can support with tepid sponging. That is, you sponge with tap water, not the cold water. This is also very important because earlier we used to sponge with cold water. Now it is not done. It is not good to do with cold water. So you use the normal water and do some sponging to reduce the fever. And if the patient is having vomiting, you can give some drugs. There are drugs your doctor will prescribe to control the vomiting. And another most important thing is you have to avoid all the non-steroidal anti-inflammatory drugs and steroids. What is this non-steroidal anti-inflammatory drugs? These drugs we use very commonly for the pain and the aches and pains and joint pain and these things. If I say some names, that is these things like Brufen and the Voltaren, these things belongs to this non-steroidal anti-inflammatory group. And you can't take steroid also, you have to avoid, that is this prednisolone, dexamethasone, Natol. And there are some patients with heart disease and all who take aspirin, clopidogrel, and dipyridamole like drugs. They have to withhold these drugs if they have dengue fever. And these patients who are treating at home has to be reviewed by a primary care doctor daily with full blood counts. The first full blood count we have to do at least on the 3rd day or after 48 hours. If the platelet count is dropping less than 150,000, full blood count has to be done twice daily. Right? In high-risk patients, who are the high-risk patients? Those pregnant mothers and elderly patients and patients with other illnesses. Sometimes we may do the full blood count even on the 1st day. But mind you, normal full blood count or bacterial full blood count will not exclude dengue fever. You have to repeat the full blood count and see what is the trend. Right? When you're looking after the patients like this at home, if they develop any of the following signs, you have to immediately return to your doctor irrespective of the time of the day. Maybe middle of the night, you have to consult the doctor. What are those signs? Patient is, fever is settling, but general condition is going down. Appetite is not improving, patient is vomiting, and patient is lethargic, but there's no fever. That is a very bad sign. And inability to tolerate fluid orally, what they take from the mouth, that is persistent vomiting. They can't keep the fluid in when they are taking. And severe abdominal pain, severe tummy pain, right? And they are lethargic, irritable and all. And any bleeding from maybe nose, maybe throat, maybe ear, and from with the vomiting. And one other thing, if they are menstruating, if their menstrual flow is heavy, that is also one indication that you have to take care of. And if they are bleeding in between their menstruation, that is also the one indication that they have increased bleeding tendency. And if they are not passing urine more than 6 hours, that is also you must see your doctor and arrange admission that patients. So that is how you are going to look after the patients at home.
Thank you, doctor. That was a very, very descriptive answer, and I learned a lot, and I'm sure the viewers have also. So many new things that I've never really read up on before, heard of before. So thank you for that, doctor. Moving on to my next question, which also I think you touched on slightly in your answer just now. What organs are affected after catching this fever?
Yes. Usually, the most commonly liver is the one that is affected. So we know most of the viral diseases, they affect the liver and brain. You can get encephalopathy and encephalitis and meningitis. So your brain is also get affected. And the heart, you can get myocarditis and you won't be able to keep your circulation normally. And the muscles, you can get myocarditis. So usually these are the organs that affects because of the dengue disease. But if you get the dengue shock syndrome, then your blood pressure is very low and you can't perfuse your organs, then you get your kidney failure also. So to protect all these organs, you have to prevent dengue.
Right. So just carrying on from what you just said, preventing dengue, doctor. How can one protect their family from this fever? What should be our role as responsible citizens to prevent and control dengue in our country?
Yes. Now, if you protect your family, that helps to protect all the community. And you have some things that you should do at the community level to uh, uh, prevent the spreading of this disease, deadly disease. So if you are a dengue patient, there are dengue viruses in your blood, especially during the first week of the illness, when your febrile phase is there. Then if a mosquito bites you, your blood will be taken into the mosquito's body, and when the mosquito is going to bite the next person, he will introduce that virus. So you have to protect dengue patients from biting. We should not allow dengue patients to bite from the mosquito. So either we use the mosquito net or mosquito repellent or whatever, we should not allow dengue patients to be bitten by the mosquitoes. And other thing is that is patients. So this disease, even though the disease is caused by dengue virus, uh, from a patient to patient, this virus is taken by a mosquito. The mosquito called Aedes aegypti. That is the mosquito which transmit the disease. Being a temperate country and a tropical country, it's very difficult to get rid of mosquitoes from country like Sri Lanka. But what we can do is uh, we can destroy the breeding sites of these mosquitoes around our residential areas, right? So how do we do that? How do we this control and destroy the breeding sites? We should properly dispose our solid waste. And a lot of these mosquitoes are breed in the man-made water collections. So what are these man-made water collections? Maybe coconut shells, used tins, and bottles that we throw away after using. So we have to dispose properly these things without allowing to collect water. Especially in these rainy seasons, there are a lot of water collections even in our gardens. We should not keep them there, and we should clean garden areas, especially during this rainy season. And sometimes this household areas may be with our water storage and all. We have to close or clean regularly these water storage areas. And we can empty regularly them and clean them, especially these flower vases and this whatever this we use for uh, preventing ants and them coming into our tables and traps with some water. So we can clean them and change them regularly. Then another thing is uh, we can use some insecticides to prevent mosquitoes breeding. Another thing is, especially this mosquito is day biting mosquito. We should control the mosquito breeding site. That is the main thing what I have described so far. And these day biting mosquitoes are biting mainly during the daytime, especially in the mornings and the evening before sunset. So if as Sri Lankans, most of the time we are concerned about our children. So in the mornings they are in the schools, and evening they are always in their play areas, maybe garden, maybe some outdoor play. So they are exposed to mosquitoes. So we have to use some repellents on them, mosquito repellents on the children, especially in the schools, and the surrounding areas we should keep them mosquito free. That's like that we can protect our family. But when we are keeping our garden clean, when each and every of us think like that, in keeping all our gardens clean, what will happen is all the community breeding sites will be destroyed. And especially we should, some organizations in your residential area, we can get together and have a Sramadana and clean the area, and those things we can organize. We can organize awareness programs, them to know that what is the risk of these mosquito-borne diseases, how deadly they are. And we can get involved all the people in the community for this cleaning programs. So that's how we should protect our community from getting these deadly diseases.
Great, Doctor. Thank you for giving so much insight on it. And I think all the listeners today will also get a sense of like the social responsibility that all of us hold as citizens in this country to make to eradicate this disease from our community, actually. Just reading on to my last question, I know we're heading towards the end. Just my last question was based on something you said about protecting our children. One thing that I've heard a lot of mothers speak about is having mosquito coils at home, and with the smoke and stuff. How safe is it when you have children around? Is there any specific type of mosquito repellent that mothers should be using, mothers or parents should be using on their children?
Yeah. Now, if you take the types of repellents that we have mosquito coils, and these vaporizers, and this citrus oil, and all. You can spray that, or you can apply on your skin also. If you take mosquito coils, if you are using these things inside your houses, if you have some function or something or in outdoor and your children are playing, using a mosquito coil is okay, because it won't does that much of harm. But if it is using indoors, especially if your children are having any respiratory system diseases like asthma, it may not good for them. They might get exacerbation of asthma because of these mosquito coils. So it's better to avoid coils. And sometimes vaporizers can be used even with the children with these things. But I think the best is use this natural mosquito repellent, something like citrus oil.
Great, Doctor. Thank you. I hope parents who are listening in would have learned a lot from this. Doctor, we've also come to the end of our session. Thank you so much for answering all our questions. You've given some great insights on how to look after yourself, your loved ones, the community, and what to do in case you do unfortunately get infected, like all the precautions that you need to take, the warning signs you need to look out for. You've gone into detail to explaining all of this. So thank you so much, Doctor, for taking the time. We really, really appreciate it. And to the viewers, if you have any more questions that you would like to ask Dr. Dulani in a more private setting, she is on the oDoc app, so you can consult her via oDoc at any time you want. Simply download the app and make a consultation with her. Having said that, I just also want to remind all our viewers that we have a special product called Home Care with oDoc, which is specially for COVID positive patients who have been asked by their PHI or their doctor to home quarantine. if you want a doctor to look after you, if you want a dedicated doctor to be checking up on you every day, you can purchase this product. You can just simply visit www.odoc.life and you can purchase this product. Again, thank you so much, doctor. We really, really appreciate it. It's been a great honor. And we as oDoc will continue to spread awareness and hopefully encourage people to be more socially responsible when it comes to these diseases. So again, thank you, doctor. And with that, I will be signing off. If you want us to explore any specific topics, please feel free to DM us the topics you would like us to explore, and we will definitely take that on board. So until the next episode on our oDoc webinar series, this is me, Shivangi, signing off. Thank you, everyone. Please stay indoors and stay safe.
Thank you.
Thank you, doctor. Bye.
Bye.